Welcome. In this new episode, we will look at the treatment of the entire lumbar, pelvic, and proximal portion of the lower extremity in the lateral decubitus position. As we have seen, the approach always starts with tissue work in the prone position. Tissue work and action at the articulatory level is fundamental to be able to go deeper and make the manipulation more effective. The work on muscular myofascial tissues always starts from the superficial portion, then it gradually leaves deeper on the entire lumbar paravertebral mass. Going down along the pelvic muscles that surrounds the sacroiliac joint, all the gluteal muscles that are inserted on the trochanter. We can work in a general way with a throughout approach. Working in a more specific way with the palm of the hand, always going down towards the muscles of the hamstrings on the ischial tuberosity insertion. This approach is also useful to work on the sacroiliac joint and ensure an input on the all sacroiliac ligaments and the sacroiliac joint itself, by using a counter force by the hand placed at the level of the anterior portion of the pelvis. This position also allows an excellent approach on the sacroiliac area, both to the ligamentous part of the sacroiliac ligaments and to the whole sacroiliac joint. You can work in a combined way with both hands going in opposite directions to create a fulcrum point. Moving up to the lumbar portion, that is the lumbar spine, the rib area, the insertion point of the paravertebral muscles, and the quadratus lumborum. This position is also excellent to work on functional units as far as disc structures are concerned.